Hello viewers, I'm Dr. Tahira, your health coach, and you are watching channel Health Show with Dr. Tahira. Come with me to the journey of health, happiness and awareness. In health today, we will discuss a very important topic and in my opinion, a very sensitive topic. Yes, what is the topic? Topic is intrauterine growth retardation or intrauterine growth restriction. What is the meaning of intrauterine growth retardation? Intrauterine growth retardation is when a baby is in the womb does not grow as expected. The baby is not as big as would be expected for the stage of the mother's pregnancy. Means baby is not as big it should be as mother's pregnancy age is. Means baby is not corresponding in size, in weight according to mother's pregnancy. This timing is known as an unborn baby's gestational age. Intrauterine growth retardation is when the fetal weight is estimated below the 10th percentile for the gestational age. It means it is below 10th percentile. What should be the age of the baby at this stage, which is corresponding with mother's pregnancy. There are two types of IUGR. When I am using word in short form IUGR, it means intrauterine growth retardation. There are two types of IUGR, symmetrical IUGR and asymmetrical IUGR. Firstly, we discuss on symmetrical IUGR. All parts of the baby's body are similarly, and in asymmetrical IUGR, the baby's head and brain are the expected size, but the rest of the baby's body is small. Now we see what are the causes of intrauterine growth retardation. Often IUGR happens because fetus does not get enough nutrient and nourishing. This can happen if there is problem within the placenta. It means baby is not getting enough nutrition, and this happens because there is any problem in the placenta. You know placenta is the tissue or the organ that brings nutrients and oxygen to the developing baby in the mother's womb during pregnancy. It is the connection between mother and the baby in the intrauterine life. Baby gets nutrition, oxygen and many other benefits from the placenta. The blood flow in the umbilical cord, there is a problem in the blood flow in the umbilical cord which connects the baby and the placenta. Intrauterine growth restriction also can happen if a pregnant woman, now we come on the mother's side, what problems are present in the mother. So the IUGR is taking place, is smoking or uses of drugs, has infections such as cytomegalovirus, German measles, means rubella, toxoplasmosis or syphilis infections. Taken some types of medication. There are some types of medication which if in the pregnancy, during pregnancy are taken by the mother due to some problems, these also cause intrauterine growth retardation in the baby. Having diabetes or high blood pressure means mother has hypertension, is carrying a baby that has a genetic disorder or birth defect. Either there is a defect, birth defect in the baby, congenital abnormality means genetically, then IUGR can occur. If a woman is pregnant with multiple, such as twins, triplets, there are also chances of IUGR. How we diagnose intrauterine growth retardation? Before babies are born, doctors check the growth of the baby and measure the mother's abdomen from the top of the pubic bone and to the top of the uterus. This is called the uterine fundal height. Yes, doctor measures either the size of the uterus or fundal height is corresponding to the gestational age or not. Then prenatal ultrasound. Yes, ultrasound shows the baby's size and weight, problems with placenta or low level of amniotic fluid. Either there is a problem in the placenta, placental localization, placenta condition, and the level of the amniotic fluid by doing the amniotic fluid index. Either it is oligohydramnios that cause the IUGR in baby, and blood flow to the placenta and through the umbilical cord. If a baby is diagnosed IUGR, if baby is diagnosed intrauterine growth retardation, doctors also do such tests such as fetal monitoring to track the baby's heart rate and movements, screening the mother for infections that could affect the baby. Yes, screening of the mother to see the infections that can affect the baby's growth. Amniosynthesis is done to do the some selective causes of IUGR, just like to help some how mature the baby's lungs are. There should be the amniosynthesis. From amniosynthesis, doctors find many information about the baby. Now we see how intrauterine growth retardation is treated. Treatment for intrauterine growth retardation depends on how far along the pregnancy is and how the baby is doing. Doctors will watch a baby with IUGR closely during prenatal visits, antenatal visits. They will do ultrasound, they will do the screening of the mother, keep track of growth and watch for other problems also. If the baby's mother has a condition, doctors will help her manage it. What are the underlying causes in the mother? The doctors will manage it. This might include making sure she eats a healthy and nutritious diet. Either mother is taking a healthy, balanced diet or not, and gains the right amount of weight, mother's weight, during her pregnancy. Some women might go on bed rest to try to improve blood flow to the baby. Sometimes doctors will recommend including inducing labor. Yes, doctor will advise seeing the condition of the patient to induce the labor and delivery early or who are very small at birth. One more likely to need to stay in the hospital for a longer time. Yes, mother can stay for a longer time in the hospital for the treatment and for the under observation. They also might need special care in the neonatal intensive care unit, means an ICU. Other problems that can be related to intrauterine growth retardation include problems with breathing and feeding, trouble keeping a steady body to maintain the temperature of the baby, abnormal blood cell counts, low blood sugar levels, hypoglycemia. Problems fighting of infection, neurological problems also. The long-term effect of IUG or intrauterine growth retardation on baby may depend on the condition that caused the problem. Means it all depends upon the underlying cause. What were the causes? So IUGR has been occurred in the baby. So follow your doctor advice, go to all antenatal visits frequently and testing appointments, the doctor. This all helps you how your baby is developing and growing. So it is very necessary to do the antenatal visits frequently as advised by your doctor, and screening, ultrasounds to see the baby's condition as soon as possible. The cause, underlying cause should be detected and treated. Thanks for watching. I think this presentation has given you some information about the IUGR. Share this video with your friends and subscribe my channel. Thanks for watching.